Malawani Ninjawar, Mujingal. I'd like to welcome you all to the traditional lands of the Walbunja people and to where my ancestors lived for thousands of generations here at beautiful Kulundalla.
Aboriginal people have one of the richest surviving cultures in the world. Through their resilience and their connection to culture, they've successfully continued to thrive for thousands of years by adapting to many different environments and circumstances.
We're facing a crisis, a major crisis, and it's not just a crisis for Aboriginal people. It's a crisis for Australia as a whole. Our prisons and our juvenile detention centres are becoming full of people with childhood histories of trauma. Every stat we have, closing the gap, everything, is saying we're failing.
The staggering issues with mental health and wellbeing for Aboriginal youth is one of our biggest concerns. Young Aboriginal people have been hospitalised for mental and behavioural disorders at more than twice the rate of other Australians. The suicide rate for Aboriginal youth is also 2 times as high.
In the generational complexity of trauma out of colonisation on Aboriginal people, there are outcomes in families, in communities.
I was going through a very hard stage in life and didn't really know which way to go, bouncing between different clinics, different psychiatrists and different helpers.
I found it very difficult to go to a clinic. As it's a foreign place, I was scared. I didn't know where to look for help. Also, it's very intimidating going straight into the clinic. It's a very scary thing to do for a kid suffering mental illness.
If our young people grow up feeling that they're not part of this country and they have undiagnosed trauma, which can be linked to diagnosis of mental illness, but I'm talking about trauma, the rage, the anger, the grief, then they're more likely to have children who are going to repeat that, and that's where we are now. We're in a generational pattern.
There's so many factors, I guess, driving these at-risk kids that I don't even know where to start. It's hard. Those kids that are at risk of homelessness, losing their connection to their people. They need connection to their family. They don't need to be taken away from their family and placed in a rehabilitation centre because they're at risk of suicide or because they've just self-harmed or they're threatening self-harm. They don't need to be taken away from their family. They don't need to be taken away from their community.
You start to hear the stories when you're on the ground in a community or you're sitting around a fire with a family who feel hopeless, disengaged because their kids have dropped out of school, their kids are not making it, and their kids are choosing what we know now is a symptom of trauma, addictions.
Evidence shows that Aboriginal people are more likely to access health services where service providers communicate respectfully, build good relationships, have an awareness of the underlying social issues as well as some understanding of culture, and where Aboriginal people are part of the healthcare team.
I have a very firm belief in the partnership of 2 minds, the Western and the Aboriginal. If they're brought together as a best practice for all people, then the healing can begin.
I think we're nervous about Aboriginal clients because we don't know lots of areas. We don't have the knowledge in that area. We're worried that we're going to offend people and then in offending them we're going to turn them away, then we're not going to be able to help them. We want to help people, and if we can't even engage properly we're not going to get good treatment.
We know culturally our people are not good closed in. You look at the rate of suicide when our people go to jail. So that's why I say out on country with the energy around you is so much better than the clinician sitting in a room, 4 walls and doing the face-to-face.